we're going to look at the thyroid storm. The thyroid storm. And to be specific, we are just going to do the treatment part of the thyroid storm. So the questions is firstly, what is the role of propranolol in case of the treatment of the thyroid? What is the role of the propranolol? The second very important question is, what is the role of the propylthiouracil? So in this video, we're going to look at the answers to these questions and learn in detail about the treatment. To begin with, we look at the IV fluids. First, we look at the IV fluids as well as the presence of the ice packs. So IV fluids and the ice packs. So what is the effect of this? It causes the rehydration. So it causes the rehydration as well as the external cooling. So two features are present. Then we look at the PTO. The PTO stands for the propylthiouracil. So this propylthiouracil, what it does is the effect is that it reduces the peripheral. It reduces the peripheral T4 to T3 conversion. Next, we look at the propylthiouracil. Next, we look at the propranolol. So what is specific about propranolol is that it blocks the adrenergic effects. It blocks the adrenergic effect. So it blocks the adrenergic effect and it reduces the peripheral conversion of the T4 to the T3. So it reduces the conversion. Next, we saw the PTU, we saw the propranolol, then we look at the CS. The CS is nothing but the corticosteroids. So the corticosteroids, what it does, it inhibits the release of the thyroid hormone. It inhibits the release of the thyroid hormones. So it inhibits the release of the thyroid hormone from the gland. Next, the CS, what it does, it reduces the peripheral conversion. It reduces the peripheral conversion from T4 to T3. So what we are seeing is the T4 to T3 peripheral conversion reduction. It takes place in almost most of the medications. Then we look at the Lugol's iodine. The Lugol's iodine or the sodium iodate. So the Lugol's iodine or the sodium iodate, they are nothing but it inhibits the release of the thyroid hormone from the gland. So it release of the thyroid hormone. So it inhibits the release of the thyroid hormone from the gland. So this was about the Lugol's iodine and the sodium iodate. Then we move on to the digoxin. So what is the digoxin related to? So the digoxin, it basically controls the associated. So it controls the associated the atrial fibrillation. Next, we move on to the diuretics and the administration of oxygen. The diuretics plus the administration of the oxygen. So what does this relate with? So here the effect is that it manages the cardiac failure. That's why you give the diuretics. Cardiac failure. Now jumping to answering our questions. So this was about the treatment of the thyroid storm. So first question we asked was in case of the propranolol. The propranolol. So what is the effect of the propranolol? The propranolol, what it does, it blocks the adrenergic effect. It blocks the adrenergic effects. Next, we have seen this very common, that is the peripheral conversion from the T4 to the T3. So this is the peripheral conversion is reduced, to be specific. Next, this is very important. The second one, we saw the propylthiouracil. The propylthiouracil. The propylthiouracil is nothing but the DOC, that is the drug of the choice, and here there is a reduction in the T4 to T3 levels, that is peripheral. So they are similar.